Well, so today in our study session, we are looking at inflammation. It's one of those topics that is examined in pathology and in microbiology. So today I'm taking you through these objectives of our study. So looking at the objectives of the study, we are going to define inflammation, the purpose of inflammation, the causes of inflammation, the cells involved in inflammation, the inflammatory mediators that we have, and majorly the process of inflammation. So, by definition, what is inflammation? Inflammation is a non-selective tissue response to injury or presence of antigens or pathogens. So, it's a non-selective tissue response to injury. The major terms here is non-selective. So, it's a non-selective tissue response to injury. What is the purpose of inflammation? Like, why does the body have to react towards the presence of these microorganisms? Process. One of them is it helps in the elimination of the cause of inflammation. So it helps to eliminate the cause of inflammation. That could be maybe the pathogens or any other cause that has led to the inflammatory response to be executed. After looking at the elimination is one of the purposes. The other one is removal of damaged tissues. So one of the major purposes is also to remove damaged tissues. And of course, the last one, which we can look at here, is majorly to help in repair. So this inflammatory response, once it comes into play, it also plays a big role in repair. So look at elimination, removal of damaged tissues, and they help in what? In repair of worn-out tissues. So those are the major reasons why this inflammation comes into play. Elimination of the microorganism, removal of the damaged tissues, and repair or initiation of tissue repair. Now, we're looking at the causes of inflammation. Allow me come on this other side and give you the causes of inflammation. Inflammation can be caused by presence of pathogens. Pathogens here can be like the bacteria, the viruses, the parasites, and anything else can actually trigger this. So, presence of pathogens is one of them. The other one is foreign materials. If foreign materials gain access to your body will react, so causing inflammation. So that's why these foreign bodies, because foreign materials come as the causes of inflammation. Then we also look at trauma. Trauma can also lead into inflammation. Trauma can also stand for injury. When your tissues get damaged by injury or by any other thing like heat or something of any other kind of radiations, it can lead into this inflammation. Not only do we see these three causing this inflammation, we also see some of these auto. Some of them are autoimmune responses. Autoimmune responses can also trigger the inflammatory response. Then we can go ahead and talk about the cells involved in inflammation. So now we are talking about the cells involved in inflammation. So the cells that are involved in this inflammatory response, allow me to list them for you. One is the neutrophils. Neutrophils are part of the white blood cells that are predominantly present in acute infection. So neutrophils are one of those cells that take part in this. And their major function is to phagocytize the microorganism which is causing this inflammatory condition. On the other side, we see the macrophages. The macrophages. So, the macrophages also take part in this inflammatory response. And for them, they take part both in acute and in chronic. So these ones take part in acute and also chronic inflammation. What do they do? These macrophages majorly take part also in phagocytosis. They take part in phagocytosis. They also take part in the removal of worn out tissues. And they also take part in the repair of damaged tissues. So they help in repair of worn out tissue. They remove the worn out tissues and they help in the repair of those worn out tissues. How? Because they help in the coordination of the growth factors that are necessary for this repair process to be initiated. That is one of the bigger advantages of these macrophages. The other cells that are involved in this are also the third one is the eosinophils. Eosinophils are part of the white blood cells that are majorly present in cases of parasitic infections and allergic reactions. So these ones take part in parasitic infections and allergic reactions. So in other words, when there is any parasitic infestation, this is actually an infestation. Once there is parasitic infestation and there is allergic reaction, you will find these eosinophils elevated. They help also in phagocytosis, and there are markers during CBC that indicate that the patient should be having some parasitic infection or allergic reaction. Then we continue and look at the fourth one, which is the basophils and the mast cells. Basophils and the mast cells are majorly present in allergic reactions, and they are the major cells that help in the production of these inflammatory mediators. For example, the histamine and prostaglandins are majorly produced by these cells that also help to counter the inflammatory response. So they are majorly present in allergic reaction. They are majorly present in allergic reaction. Then we continue further and talk about the fifth one, which is the lymphocytes. Lymphocytes are majorly significantly present in cases of chronic infection. So these lymphocytes come into play in most cases when the patient has got a chronic infection, or in certain occasions when the patient has got a viral infection. So this also comes into play to help in the destruction of these microorganisms or the cause of the inflammatory response. So these ones proliferate further to give you the B lymphocytes and the T lymphocytes and the natural killer cells. So we have got the natural killer cells, the T lymphocytes and the B lymphocytes. What's the difference between the two? These are all lymphocytes that are produced from the bone marrow, but these ones take part to mature within the bone marrow. These ones go ahead and mature from the thymus gland and proliferate further to produce, and they can all go ahead and proliferate and perform other functions that help in defense. For example, production of the antibodies that also help in your immunity as a human being. So allow me to take you through the inflammatory mediators. So what are these inflammatory mediators? Inflammatory mediators, these are chemical substances that take part in regulation of this inflammatory response. So these are chemical substances that mediate the inflammatory response. So these inflammatory mediators have examples like histamine, prostaglandins, serotonin, bradykinins, or you can call it bradykinins or bradykinins. Then you've got cytokines and several others like interleukins. So you've got the interleukins, the cytokines, the bradykines, serotonin, prostaglandins, histamine, and many more others. So these are the inflammatory mediators that help this inflammatory response to take place. So allow me to take you through the process of inflammation, a step-by-step process through which inflammation takes place. And majorly, I'm dealing with acute inflammation. So I'm talking about the process of acute inflammation. Now, first, what you need to know, for this inflammation to take place, first thing you need to know first is trigger factors. So there must be the presence of the trigger factor. The trigger factors here can be, I can call them microbes. These microbes can be viruses, parasites, or any other microorganism like viruses can lead into this. So first one is the trigger factors. So these trigger factors are like the causes. The cause must be present for the inflammatory reaction to take. So the first thing you need to know is the presence of trigger factors. Then you say the presence of trigger factors helps to initiate the inflammatory response. Why? Because these trigger factors like the microorganisms will go to the next part to damage the cells. What do? They damage the cells. They damage your body cells. Once your body cells are damaged, your body cells release chemical substances, which are called the inflammatory mediators. So here now you see damage of the cells leading to production. So now you see here, this production of inflammatory mediators. Which means there's production of chemical substances that can initiate this inflammatory response. So once these inflammatory mediators come into play, what do? Now you go to the next one. This is the third one. The fourth one, based on the functions of these inflammatory mediators, they go ahead and do what they call vascular changes. So, production of the inflammatory mediators now leading to vascular changes. So, the vascular changes means there will be dilatation of the blood vessel. So you see, if this is your blood vessel and the microorganism is located in this area, of course, your blood is moving. Your blood is moving inside the blood vessel. So once there is an antigen, the body has detected the presence of an antigen, and the antigen has damaged some few cells around this area. The cells have produced some chemical substances like the histamines and the prostaglandins. What do? These ones will, the chemical substances that have been produced, these inflammatory mediators, they travel to the blood vessel. When they travel to the blood vessel, will lead into dilatation of the blood vessel. So this blood vessel will increase. You will see this blood vessel increasing in size. Once this blood vessel increases, why is there increase in the blood vessel size? In order to accommodate the influx of more blood cells. So there will be need for blood cells in this area. Of course, the white blood cells, the red blood cells, and the plasma proteins. All these are placed to resolve to its normal functionality. So what happens? Here you're now seeing the increase of the blood vessel to allow influx of the blood into that area. So as the blood comes to this area, so as I told you, this was vascular changes, which was number 5. Is it number 5? So the 6th one now, after there is vascular changes, now there will be what they call cellular movement. So the other one was vascular changes, which has led to opening of the blood vessels to allow influx of blood cells. Now, the next one is cellular movement. What happens in cellular movement? This blood cells will need to diffuse away from here. So these vascular changes also do not only incorporate enlargement of the blood vessel, but they also involve permeability. In other words, as the blood vessel increases, there will be creation of pores along this area. So you see, there will be pores created on this area. Why? These pores are necessary for the movement of these blood cells downwards. So first what happens is vasodilatation, and now cellular movement starts. What happens? These blood cells, assuming these are white blood cells, these red blood, they will start to fall on the lining of the blood vessel, which is called margination. So what happens in cellular movement? One is margination. Margination is the movement of these white blood cells towards the endothelium lining of the blood vessel, which is called margination. After margination, assuming these red blood cells have started falling from these other areas, so what happens? Of course, the target antigen is here. So once they are falling from this other area, which is called margination, the next one is rolling. These blood cells will be forced to roll towards the site of the antigen because the antigen is here. So they will be forced to roll when they are on this, rolling towards the site of the antigen, when they are still within the blood vessel. As they keep rolling towards this site, the next one that will happen, which is the third one, is what they call adhesion. Adhesion simply means attachment. They will have to roll, and finally they will attach where they need to pass from. So that's what they call attachment, which is a firm connection of these white blood cells towards white blood cells on the pores where they're going to escape from. So after they have attached, the next step is what we call the fourth one. Allow me to wrap this up. Oh, let me use this one. The fourth one is what we call diapedesis. Diapedesis, by definition, is the movement of these inflammatory cells, or the white blood cells, across this endothelium lining of the blood vessel. So diapedesis is the first one, which is the movement of these white blood cells across this blood vessel towards the site of the antigen. That's diapedesis. So after this white blood cells have crossed, now you see them, they are outside the blood vessel. Once they have crossed, assuming this microorganism is maybe here. So after they have crossed, now they're outside. The next step, which is the fifth one, is what they call chemotaxis. Chemotaxis is a unidirectional movement of these blood cells, or these white blood cells, from the point of diapedesis to the target antigen. So the movement process from here, that is chemotaxis. So chemotaxis is majorly aided by the presence of the complement system. So we have got what they call the complement components that help the movement of these molecules or these white blood cells from this area to this side. So the chemotaxis is majorly aided by the complement component, which is majorly the component 3A and the component 5A. They are the major ones that majorly help in this chemotaxis movement. So once this movement has happened and these white blood cells have identified microorganism, what happens when they've reached, the chemotaxis has helped them to reach to the microorganism. Once they have reached to this microorganism, they will engulf the microorganism. That means encircle the microorganism and phagocytize. So after chemotaxis, the next one is, the sixth one is phagocytosis. So they will go ahead to phagocytize this microorganism. They will engulf the microorganism and phagocytize this microorganism. So this process is majorly aided by the lysozymes, because these white blood cells, the neutrophils and the macrophages contain the lysozymes that help in the phagocytosis process. So that is the cascade of how these microorganisms, actually this inflammatory response comes to save you from the presence of these antigens. So thank you so much. If this video has been of great importance to you, I would ask you to subscribe, like, and share. Thank you so much.